Your ovulation and menstrual cycle are super important indicators for your chances of getting pregnant. Today, I'm going to be giving you tips that you need to understand your cycle and what it says about your fertility. Along the line in this video, I'll also give you extra tips on how to understand if and when you're ovulating and the best opportunities to achieve pregnancy. To have a baby, you need a healthy uterus with tubes, you need sperm, and then you need ovaries. These ovaries houses what we call follicles. Follicle is like a sac for your eggs. Now, during your menstrual cycle, your brain releases a hormone called the follicle stimulating hormone. This hormone will stimulate these follicles and then one of it will grow bigger. When this grows bigger, it will release estrogen, which will instruct the uterus to start creating linings to prepare for pregnancy. Now, one of these follicles will grow bigger, others would go away. So this happens every month. So when one grows bigger, others will go away. Next month, another set will come. Once this follicle is ready and fully formed, it will instruct the brain, hey, I'm ready to release my egg. The brain will respond by releasing a luteinizing hormone, which will cause you to ovulate. Ovulation is the most intense period of your menstrual cycle. Sperm and egg meet in the fallopian tube. The fallopian tube and the ovaries are not connected, so it has to find a way to vacuum out the developed egg. And if the egg makes it into your fallopian tube, it's going to live for a day. So if you had sex that week and there's enough healthy sperm ejaculated by your partner, then there might be some sperm to swim into the fallopian tube to fertilize that egg. If the egg is fertilized, it turns into an embryo. After 5 days, this embryo is pushed into your uterus to be implanted. After this, your body produces HCG, which is pregnancy hormone. Then you miss your period. But if the egg does not get fertilized, then after 2 weeks of your ovulation, you see your period. I totally lied to us in high school. It is not easy to be pregnant. One thing to note is that a woman's period is brought about by the release of an egg. So 2 weeks after a woman's ovulation, two things will either happen. See that she's pregnant or we see blood. So when a woman comes to me and says, I know exactly when my period is coming, I know the day is very consistent, then I know for sure that she's releasing an egg. If you can consistently tell when your period is coming and is consistent and is regular, then you are definitely releasing an egg. And you probably see your period about 12 to 14 days after ovulating. That is if the egg is not fertilized. So as a woman, if you can consistently tell when your period is coming every month, then you can predict when you have the LH surge and when you should shoot for pregnancy for better chances. This is why predictability is very important in a woman's menstrual cycle, and consistency is also very vital. If a woman comes to me and says they see their period every 21 days, like clockwork, right on the nail, regular, consistent, that's not normal, because even though it's consistent and regular, it's coming too soon. If a woman then says she sees her period every 2 months, 60 days, right on the money, right on the clock, regular, consistent, that's also not normal. Because for such women, the periods are probably an ovulatory period, which means an ovulation that comes not from an ovulated egg. When a woman has a period, it is not the egg that is coming off, because the egg has come and gone like 2 weeks before. It is the lining of the uterus that is shedding off. So if a woman has this kind of inconsistent periods, then they are not as a result of an ovulated egg, so they can come anytime they want. So a woman can have periods without proper release and ovulation of an egg. If a woman's menstrual cycle is wide in range, highly unpredictable, very irregular, comes 2 times in a month, 3 times in a month, once in 3 months, once in 2 months, sometimes it doesn't come at all, sometimes little spots in here and there, then this woman is not having an ovulatory cycle. This is a condition called oligo-ovulation, meaning that the woman is not ovulating as frequently as she should. One of the major causes of oligo-ovulation is a condition called PCOS, polycystic ovary syndrome. That is like a whole big topic on its own, but there are 3 criteria that determine this. Number 1 is irregular periods. Number 2 is over 12 follicles in your ovaries via an ultrasound. And the last one is high testosterone levels. So a woman might not have all the 3, but we're looking out for 2, which most women have the first 2. Irregular periods and high follicles via an ultrasound. Other conditions that causes oligo-ovulation includes maybe if you're an athlete and then you've worked out and you've lost weight, your body might see it that you are not nourished enough to have a baby. So that can be an issue with your ovulation. Then number 2 could be fewer eggs available. Number 3 could be adrenal issue, what they call congenital adrenal hyperplasia. Then also thyroid issues, and then high prolactin levels. These can cause problems with your ovulations, and sometimes it can be unexplained reasons, which sometimes is termed as unexplained ovulatory problems. Some women see their periods in the nick of time, very regularly, consistently, but then it's very, very painful. You find them rolling on the bathroom floor, crying in agony, debilitating pain, waking the neighbors at night. That is not normal, and I feel very concerned for such women. Some of them even complain about having heavy periods, that they require a tampon as well as a pad to be able to wedge the fluid that is coming out. And some even say they have spotting a week before the main period. Sometimes these women also complain about very painful sexual experiences and then difficulty in getting pregnant. So when I hear about all these symptoms, what I think about is a condition called endometriosis. Now, endometriosis is a condition whereby the lining of the uterus moves to other parts of the body. It's not cancerous, it doesn't form cancer, but it can prevent you from getting pregnant. Now, these cells growing in the wrong places can really affect your chances of getting pregnant. And the very painful thing is, just as the lining of the uterus bleeds after every menstrual cycle, other places where those lining grows will also bleed every menstrual cycle, which is very plus, this bleeding can be very painful. Now, the body realizing that these cells are growing in the wrong places will start fighting it to kill it. So these will form scar tissues. These scar tissues will wrap around your ovaries. So even though you're releasing the egg, ovulating, regularly, but this egg is finding it difficult to be able to migrate into your fallopian tube to get fertilized, which would cause severe infertility. And such women will need help in getting pregnant. While there are various options, treatment options, the one that I know that really works for women is the FOG herbal powder from GreenPawa. What does triple FOG mean? Fibroid shrinker, fertility booster, flow regulator, ovulation booster, general female wellness. You can see here, also treats PID, PCOS, high prolactin, etc. It is a combo, comes with this powder and a solution. Perfect for any woman who has endometriosis, fibroid, ovulation problems, fertility issues. If you have a regular menstrual cycle as a woman, then you can be able to track your ovulation by using a chart or an app. So this app will be able to tell you when you have an early surge. So 24 hours after the peak of your luteinizing hormone surge, you should have your ovulation. So if you have a cycle of between 28 to 31 days, then you should have your early surge around 14th day, right? Then you should start meeting your partner maybe 2 days before that time for higher chances of pregnancy. On the other hand, if you have irregular menstrual cycle, then it might be very difficult to track your ovulation via apps or ovulation kits, because then you will get highly irregular results and very unpredictable results that won't be able to lead to pregnancy very quick. So what I say to women is, if you are under 35 and your menstrual cycle is regular, then you can try for 1 year before panicking. That is if you're trying to conceive. But if you are above this and then your menstrual cycle is irregular at the same time, you're welcome to try for a couple of months, but don't try for too long. You need help. So if you have such fertility issues, you can talk to us via DM. We can help you sort these issues, ask you some questions, and then know what to proffer to you to help you get pregnant and carry your own child. So I wish for everybody to have their own children and be happy, live a life of fertility and bountiful, joy with kids around. Stay healthy. This is GreenPawa, and I'll see you on the next one.